everyone, it's me again, Nurse Clary, and in this video, I would like to summarize our previous topic about epilepsy and seizure, and after that, we will go ahead with the questions and answers with Rationale. So, of course, we talk about the abnormal electrical discharge of neurons in the brain, which is epilepsy, seizure, and status epilepticus. So let's define epilepsy. Epilepsy is a central nervous system or neurological disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. It is a neurological condition characterized by two or more unprovoked seizures. So this is the most important thing. Next is seizures. Seizure are abnormal movements or behavior due to unusual electrical activity in the brain, and seizure is actually a symptom of epilepsy, and this is actually a single occurrence. So status epilepticus. When a seizure lasts longer than 5 minutes, then that's what we call status epilepticus, or having more than one seizure within a 5 minutes period without returning to a normal level of consciousness between episodes, which is a medical emergency that may lead to permanent brain damage or death. That's why we need to activate emergency response during that time. And we should make sure that we time the seizure of our patient. So that's very important because longer than 5 minutes, it's a medical emergency. Next is we should understand that there are two types of seizure, generalized and the focal seizures. And generalized seizure affect both sides of the brain. There are two types, absent seizures and tonic-clonic seizures. Absent seizures, also known as petit mal seizures, can cause rapid blinking or a few seconds of staring into space. While tonic-clonic seizures, also called as grand mal seizures, can make a person cry out, lose consciousness, fall to the ground, and have muscle jerks or spasms. Remember, I discussed about tonic-clonic. So when you say tonic, muscles in the body become stiff, while clonic, periods of shaking or jerking parts on the body. So when you say tonic-clonic, stiffing and shaking and jerking. Next is focal seizures. So focal seizures are located in just one area of the brain. So generalized both sides, while focal seizures are just in just one area of the brain. These seizures are also called partial seizures. So we have three types of this, which is simple focal seizures, complex focal seizures, and secondary generalized seizures. When you say simple focal seizures, these seizures can cause twitching or a change in sensation, such as a strange taste or smell. Complex focal seizures can make a person with epilepsy confused or dazed. The person will be unable to respond to questions or direction for up to a few minutes. So secondary generalized seizures begin in one part of the brain but then spread to both sides of the brain. So in other words, the person first has a focal seizure followed by a generalized seizure. So seizures last as long as a few minutes, but it should not last more than 5 minutes because that would be status epilepticus. So phases, we have prodromal, aural, ictal, and post-ictal. When you say prodromal phase, it involves mood or behavior changes that may precede a seizure by hours or days, while aura is a premonition of impending seizure activity and may be visual, auditory, or gustatory. So ictal stage is characterized by seizure activity. So ictal stage is the time it is during seizure already, so seizure activity. Next is post-ictal stage. It is after the seizure, so it is the period of confusion, somnolence, and irritability. Next is the main problem. The main problem here is the abnormal electrical discharge of the neurons. Why there is abnormal electrical discharge? Because there is imbalance of neurons in the brain. That's what I discussed previously about the simple pathophysiology about the inhibitory and excitatory neurons. Next is the nursing interventions. So for the nursing interventions, we have before, during, and after seizure. So before seizure, of course, if we have assessed the patient and the patient has the epilepsy, or the patient has a lot of factors to have seizure, so seizure precautions must be in place. So it composed of oral airway, oxygen suction should be it should be available, and then keep bed in a low position, side rails up, padded side rails. While during seizure, you should stay with the patient to protect from injury, observe the seizure activity, and make sure to time it. Then, if the patient is on the chair or out of bed, make sure to help him to the floor. Place a towel or folded blanket under the head of the patient. Next, if the patient is in the bed, remove the pillows, raise the side rails, put the bed in the flat position, loosen any restrictive clothing, and make sure to clear the area of objects that could hurt the patient. So the safety of the patient is very important. Next is after the seizure, assess for respiration. So after the session, we should assess the patient and calmly reassure and reorient the patient. And then, of course, the most important thing to assess first is the respiration and pulse. So if there is respiration and pulse but unresponsive, turn him to side. If necessary, insert an oral airway, use suction to remove secretions. If needed. So we need to take the vital signs, and then if pulse or respirations are not present, of course, we need to call for help and start CPR. But if everything is okay, then we can cover the patient with a blanket for warmth and privacy, and then reassure and reorient, and then perform a neurologic assessment, observe and document characteristics of seizure, and indicate if the patient reported an aura or if there are other signs and symptoms observed prior to seizure. So we should remember the don'ts, like don't restrain your patient during a seizure, don't try to open the patient clenched jaws or force anything into his mouth, don't move the patient unless the environment is unsafe, don't suction the patient or pharynx until motor activity stops. Next is the medication. So medications, of course, are anticonvulsants. But here are the most common medications for the seizure. We have barbiturates or phenobarbital. So these are used for tonic-clonic focal seizures and status epilepticus. Side effects is drowsiness, uncoordinated movement. So phenobarbital is barbiturates, and we should watch out for respiratory depression and hypotension. Next is lorazepam or diazepam. Lorazepam, diazepam are benzodiazepines. So these are used for status epilepticus and they are fast acting. So this is used for absence seizure, tonic-clonic, and focal as well. So the patient will be very drowsy, tolerance can develop, and there could be liver impairment. So the reversal agent for benzo, or we can say as benzodiazepine antagonist, is flumazenil. Next is phenytoin. Phenytoin, they are hydantoins. They are used for tonic-clonic or focal seizure. So for this, we need to watch out for the gums of the patient because the patient gums might be enlarged and easily bleed. So the this could be gingival hyperplasia, and it may cause bone marrow suppression. So we should watch out for the platelets and WBCs. And then we should not give this with milk or antacids because it interferes with absorption. Next is valproic acid. So this is used for absent seizures, partial seizures, and generalized seizures. But this one can cause serious birth defect. That's why the doctor should be informed if the patient will be having a baby or they are planning to have a baby. Alright, so let's go ahead and answer the sample Nclex questions. So steps in answering Nclex questions: read, know the topic, know if you are looking for a positive or negative answers, and then watch out for the keywords. So first question: the male client is sitting in the chair and his entire body is rigid with his arms and legs contracting and relaxing. The client is not aware of what is going on and is making guttural sounds. Which action should the nurse implement first? Number 1, push aside any furniture. Number 2, place the client on his side. Number 3, assess the client's vital signs. Number 4, ease the client to the floor. So the topic is about the patient having a seizure activity, because they actually define seizure rigid with his arms and legs contracting and relaxing. The client is not aware of what is going on and is making guttural sounds. So what's the first implementation? Yes, it's okay to push aside any furniture. So first action, it means it's positive answer. We're looking for a positive answer. And then of course, this is what I'm writing on my board: seizure MS, positive answer, and I'm looking for the first action as a nurse to implement. Push aside any furniture. I can do that. So it's like clearing the area so that the patient will be safe. So place the client on his side. I think that's the last part, placing the client on his side. Next, third is assess the client's vital signs. Yes, I can do that, but it's after the seizure. So 4 is ease the client to the floor. For me, my answer here is 4, ease the client to the floor, because on the question, the male client is sitting and I'm looking for my first action. Of course, I need to ease the patient to the floor first and then time the seizure, make sure that the patient is safe. I can push aside any furniture if there is, but for me, the first action to take is ease the client to the floor, and that is the correct answer, number 4. The client should not remain in the chair during a seizure. He should be brought safely to the floor so that he will have room to move the extremities. Next question is the occupational health nurse is concerned about preventing occupation-related acquired seizures. Which intervention should the nurse implement? So number 1, ensure that helmets are worn in appropriate areas. 2, implement daily exercise programs for the staff. 3, provide healthy foods in the cafeteria. 4, encourage employees to wear safety glasses. So the topic is about seizure again. Just want to classify them if it's MS, pediatric, maternity, psych, that I'm dealing with. I would just want to know in what area I am answering, if it's under medical, surgical, pediatric, or maternal. So that's why I'm just putting if it's seizures, it's under nervous system. We are looking for a positive answer because the question say, which intervention should the nurse implement? So the keyword here is implement. So what I am writing on my board again is seizure. It's under MS or medical surgical, plus because I need to look for the positive answer, and then implement. So I will read again the question. Which intervention should the nurse implement? 1. Ensure that helmets are worn in appropriate areas. Since this is occupational health nurse, helmets are very important, especially when it comes to acquired seizures or occupation-related acquired seizures. Because as we all know, seizures is under nervous system, so it's the head that we need to protect. Number 2, implement daily exercise programs for the staff. I don't think that's a good idea, but it's not directly related with the seizures. So provide healthy foods in the cafeteria. Yes, that's also good for the health of the patient, but it's not directly related to the seizures. Encourage employees to wear safety glasses. It's okay also, the safety glasses, but the main point here is the head, because the head seizures is about abnormal electrical activity of imbalance of neurons in the brain. So my answer here is actually number 1. Yes, that's number 1. Head injury is one of the main reasons for epilepsy that can be prevented through occupational safety precautions and highway safety programs. So next is number 3. So the client is scheduled for an electroencephalogram to help diagnose a seizure disorder. Which pre-procedure teaching should the nurse implement? Number 1, tell the client to take any routine anti-seizure medication prior to the EEG. Tell the client not to eat anything for 8 hours prior to the procedure. Number 3, instruct the client to stay awake for 24 hours prior to the EEG. Number 4, explain to the client that there will be some discomfort during the procedure. So the topic again is about seizure disorder, diagnosing seizure disorder, and then EEG, so electroencephalogram. So which pre-procedure teaching should the nurse implement? So with the question, we're looking for the positive answer. So this is the keywords. It's about seizures, still under medical surgical, positive answer, and then teaching. What do we need to teach the patient? And for the electroencephalogram, always remember that during EEG, we need the patient to have his seizure activity so that they can diagnose what part of the brain is being affected. So number 1, tell the client to take any routine anti-seizure is wrong, because we need the patient during EEG to have the seizure activity. Number 2, tell the client not to eat anything for 8 hours prior to the procedure. It's not as well. And then number 3, this is correct. Instruct the client to stay awake for 24 hours prior to the EEG, because sleep deprivation is one thing to induce a seizure. Explain to the client that there will be some discomfort during the procedure. There will be, because the patient will have his seizure activity, but the nurse should teach the patient pre-procedure to not sleep, so that the process on which we will induce the seizure will be faster. So the answer here is number 3. Instruct the client to stay awake for 24 hours prior to the EEG. The goal is for the client to have a seizure during the EEG. Sleep deprivation, hyperventilating, or flashing lights may induce a seizure. So next question is number 4. The nurse enters the room as the client is beginning to have a tonic-clonic seizure. What action should the nurse implement first? Number 1. Note the first thing the client does in the seizure. Number 2. Assess the size of the client's pupils. Number 3. Determine if the client is incontinent of urine or stool. Number 4. Provide the client with privacy during the seizure. So what's the topic? So the topic is about tonic-clonic seizure and the patient is just beginning. So what action should the nurse implement first? So we are looking for a positive or negative answer. We are looking for a positive answer, and the keyword of course is first. So it's about seizure, it's under medical surgical, positive answer, and then first to implement. So note the first thing the client does in the seizure. Yes, this is correct. We should note the first thing the client does during the in the seizure, and then assess the size of the client's pupils. It's not yet necessary because the client is having a seizure. Determine if the client is incontinent of urine or stool. This is done after the seizure. Provide the client with privacy during the seizure. Yes, this is okay to provide the client with privacy during the seizure, but we need to stay with the patient during the seizure. And then number 1, we need to note the first thing the client does in the seizure. So my answer here is number 1. That's the first, because we're looking for the first to do. Number 2, all of it actually are correct. However, the first thing to do is number 1. Note the first thing the client does in the seizure, because noticing the first thing the client does during a seizure provides information and clues as to the location of the seizure in the brain. It is important to document whether the beginning of the seizure was observed. Number 5, the client who just had a 3-minute seizure has no apparent injuries and is oriented to name, place, and time, but is very lethargic and just wants to sleep. Which intervention should the nurse implement? Number 1, perform a complete neurological assessment. 2, awaken the client every 30 minutes. 3, turn the client to the side and allow the client to sleep. 4, interview the client to find out what caused the seizure. So the topic, of course, is about seizure. However, during this time, the patient, this is after the seizure already. So, are we looking for a positive or negative answer? We are looking for a positive answer, because which intervention should the nurse implement? So again, it's about seizure under medical surgical, positive answer, and keyword is what the nurse will implement. So implement. So number 1, perform a complete neurological assessment. From the question, yes, we need to perform neurological assessment. However, it was written on the question that the patient is very lethargic and just wants to sleep. And then number 2, awaken the client every 30 minutes. It's not necessary because the patient wants to rest. And if you awaken the patient, like I said earlier, sleep deprivation can induce a seizure. So we turn the client to the side and allow the client to sleep. For me, this is my answer. Turn the client to the side. Yes, that is what the patient wants to do, to to sleep, and then we need to turn the client on their side so that to prevent any aspiration if there's still secretions. Number 4, interview the client to find out what caused the seizure. But even though I think that number 3 is the answer, I still look for the number 4 because maybe that is the best answer. Because sometimes in the Nclex questions, most of the time I think most of the time all of the answers are correct, but you need to find the best answer. So if you think number 1 is the correct answer, you still need to look on number 2, number 3, and number 4 to make sure that that is the best answer. So for me here, I am considering number 3. So number 4, interview the client to find out what caused the seizure. This one I can do it later on after the patient rest, because it's stated it is stated in the question that the patient wants to sleep, so we need to let him sleep, allow the client to sleep. So the answer is number 3. So during the post-ictal or after seizure phase, the client is very tired and should be allowed to rest quietly. Placing the client on the side will help prevent aspiration and maintain a patent airway. Next. The unlicensed assistive personnel or UAP is attempting to put an oral airway in the mouth of a client having a tonic-clonic seizure. Which action should the primary nurse take? Number 1, help the UAP to insert the oral airway in the mouth. 2, tell the UAP to stop trying to insert anything in the mouth. 3, take no action because the UAP is handling the situation. 3, notify the charge nurse of the situation immediately. So the topic is about tonic-clonic seizure. It is during seizure and the UAP is interfering, like attempting to put an oral airway in the mouth of the patient. So that's the topic. So is it are we looking for a positive or negative answer? So the question is, which action should the primary nurse take? So we are looking for a positive answer. Next, so the keywords here are the seizure, it's under MS, positive answer, and the primary action a nurse should take. So help the UAP. So I have discussed this earlier that we don't try to open the patient clenched jaws or force anything into the patient's mouth. So we need to interfere. Number 1 is wrong already because we should not help the UAP because it's a don't. Number 2, tell the UAP to stop trying to insert anything in the mouth. This is the correct answer that I'm considering. We need to stop the UAP right away. Then 3, take no action because the UAP is handling the situation. Number 3 is wrong because UAP is doing something wrong, so we need to stop it. Number 4, notify the charge nurse of the situation immediately. We will notify the charge nurse after we stop the UAP because the safety of the patient is in line, so we need to stop the UAP right away. So my answer here is number 2. Tell the UAP to stop trying to insert anything in the mouth. The nurse should tell the UAP to stop trying to insert anything in the mouth of the client experiencing a seizure. Broken teeth and injury to the lips and tongue may result from trying to place anything in the clenched jaws of a client having a tonic-clonic seizure. So next is 7. The client is prescribed phenytoin, dilantin, an anticonvulsant for a seizure disorder. Which statement indicates the client understands the discharge teaching concerning this medication? Number 1, I will brush my teeth after every meal. Number 2, I will check my dilantin level daily. Number 3, my urine will turn orange while on dilantin. Number 4, I won't have any seizures while on this medication. So the topic is about seizure disorder and phenytoin. So it's still under seizure, and we're talking about the medication, and that is phenytoin or dilantin. So are we looking for a positive or negative answer? We're looking for a positive answer. From the question, which statement indicates the client understands the discharge teaching concerning this medication? So the keyword here is understand. So this is about the understanding of the patient on the discharge teaching regarding the medication phenytoin. So number one, I will brush my teeth after every meal. Remember, I discussed about phenytoin earlier, that it's one of the thing that we need to watch out is the bleeding as well as the gingival hyperplasia. So I will consider number one, I will brush my teeth after every meal. Number two, I will check my dilantin level daily. It's not necessary to check it daily. Number three, my urine will turn orange while on dilantin. It will not turn orange during while on dilantin. I won't have any seizures while on this medication. So that is not actually true, that you will not have any seizures while on this medication. You can still have seizure. So the answer here for me is number one, which is the correct answer, because thorough oral hygiene after each meal, gum massage, daily flossing, and regular dental care are essential to prevent or control gingival hyperplasia, which is a common occurrence in clients taking dilantin. So number 8 question. The client is admitted to the intensive care department or ICD experiencing status epilepticus. Which collaborative intervention should the nurse anticipate? So number 1, assess the client's neurological status every hour. Number 2, monitor the client's heart rhythm via telemetry. Number 3, administer an anticonvulsant medication by intravenous push. Number 4, prepare to administer a glucocorticosteroid orally. So what is the main topic? It's about status epilepticus, or still under seizure disorder, and it's about collaborative intervention. So we are looking for a positive answer. So for the collaborative intervention, from the word itself, collaborative, it's a team intervention. So the keyword is collaborative, and this is about status epilepticus, still under MS. We are looking for a positive answer, and collaborative is the keyword. So assess the client's neurological status every hour. That's one of our duty already as a nurse. Monitor the client's heart rhythm via telemetry. That's one of our duty as well. Administer an anticonvulsant medication by intravenous push. I will consider this because we need a doctor's order for this one. Prepare to administer a glucocorticosteroid orally. Number 4, it's also about medication. So for me, 3 and 4 is the 3 and 4 is my possible answer. But administering an anticonvulsant medication by intravenous push requires the nurse to have an order or confer with another member of the healthcare team. So the best answer here is number 3. Administer an anticonvulsant medication by intravenous push, because this is more on collaborative intervention. Next is number 9. The client has been newly diagnosed with epilepsy. Which discharge instruction should be taught to the client? So select all that apply. Number 1, keep a record of seizure activity. Number 2, take tab baths only, do not take showers. Number 3, avoid over-the-counter medications. Number 4, have anticonvulsant medication serum levels checked regularly. And then number 5, do not drive alone, have someone in the car. So the topic is about epilepsy and about discharge instructions, and this is a SATA question, so we will use a true or false. Are we looking for a positive or negative answer? We are looking for a positive answer because the question is about discharge instructions that the nurse should be taught to the client. So it's about epilepsy, is still under medical surgical, and we're looking for positive answers, and thought is the keyword. So what do we teach the patient? So number 1, keep a record of seizure activity. Yes, it is important. Keeping a seizure and medication chart will be helpful when keeping follow-up appointments with the healthcare provider and in identifying activities that may trigger a seizure. Take tub baths only, do not take showers. I think this is not necessary. The patient can still take showers even though the patient is diagnosed with epilepsy. Number 3, avoid over-the-counter medications. I think for me this is true. Over-the-counter medications may contain ingredients that will interact with anti-seizure medications, or in some cases as with use of stimulants possibly cause a seizure. And aside from that, over-the-counter medications, we should always inform the doctor if we will take any medications, because for the anti-seizure medications, there are a lot of medications that could interact with it. So number 4, have anticonvulsant medication serum levels checked regularly. This is also correct. It is very important that the medication serum level is being checked. Most of the anticonvulsant medications have therapeutic serum levels that should be maintained, and regular checks of the serum levels help to ensure the correct level. Number 5, do not drive alone, have someone in the car. This is actually not necessary for the patient diagnosed with epilepsy. They can still drive. So my answer here is 1, 3, and 4. And that is 3 answers. Number 10, which statement by the female client indicates that the client understands factors that may precipitate seizure activity? Number 1, it is alright for me to drink coffee for breakfast. Number 2, my menstrual cycle will not affect my seizure disorder. Number 3, I am going to take a class in stress management. Number 4, I should wear dark glasses when I'm out in the sun. So the topic here is about seizure again. So the client understands factors. It is about the factors that may precipitate seizure activities. So we are looking for positive answers, and so it's still seizure and then MS positive, and we need to look for, and the keyword is understand. The client understands the factors. So for number 1, it is alright for me to drink coffee for breakfast. For me, that is wrong. That it has nothing to do with the seizure activity. My menstrual cycle will not affect my seizure disorder. that is not connected as well. I'm going to take a class in stress management. Yes, this is connected with the factors that may precipitate seizure activity. It means the client understand what are the factors that could precipitate seizure activity, because the coffee for breakfast and the menstrual cycle, they are not included in the factors that could precipitate seizure activity. I should wear dark glasses when I am out in the sun. So this is not understanding the factor as well that could precipitate seizure activity. The answer here is number 3, because tension states such as anxiety and frustration induce seizures in some clients. So stress management may be helpful in preventing seizures, because number 3 is the only thing or the only answer that take actions on removing that stress, so that seizure activity will not happen. So it means that the client understands the factors that may precipitate seizure activity. So, alright, thank you for watching. On my next video, I'll be discussing about the autoimmune diseases such as MS or multiple sclerosis, GBS, Guillain-Barré syndrome, and Alzheimer's disease. Again, thank you. See you on my next video. Bye.